Hey everyone, this is Ivana with AL.com, again here on your lunch break. Today I am talking with Dr. Suzanne Judd from UAB School of Public Health. Dr. Judd is an epidemiologist, and she's here to take some of y'all's questions. Even some of us at AL.com had some questions that I'm going to throw at her. So I appreciate it so much, Dr. Judd, for being here. I know that you got a lot going on, and it is definitely a time where you are busy.
Yes, absolutely. Thank you for having me. I'm excited to be here today.
Awesome. Well, I have got, so if you all see me looking down, I got a whole page of questions. I'm watching our comments to make sure that we get all those questions answered on there. So if you see me looking down, I got all kinds of things going. So first, let me ask you something that a lot of people have been commenting and saying, what are the treatments that the people who are hospitalized with COVID-19 and they have a confirmed case, what kind of treatments are those people getting in the hospital?
There are a lot of treatments that vary, and I haven't seen what they're doing today. We don't have any treatments that are approved yet by the Food and Drug Administration. So it's going to depend doctor to doctor. They've got great options in terms of getting people on ventilators and getting the inflammation down, but really it's still evolving.
Right. Well, that kind of goes along with a couple other people have asked, how do you know when you are better? Is this like the flu and you can go back out if you have 24 hours free of fever? Or when do you know that you are kind of over the hump?
No, we're really asking people for 14 days. Even if you feel better, we're asking you to continue to self-quarantine for 14 days. There are evidence from China and from Italy that this you stay infectious much longer than you would with the flu. So that advice of 24 hours fever-free is not what we're giving people with COVID-19.
So flu guidelines and COVID-19 guidelines are not the same at this point.
They're not the same. Nope, we're really asking people to continue to self-quarantine, even if you're feeling like you could run a marathon. We're asking people to self-quarantine to make sure you don't spread it to someone else, even though you're feeling well.
Does that self-quarantine start from when you start feeling symptoms or restart rather when you get a confirmed test?
It restarts when you get a confirmed test, just because that's the recommendations that we got from the CDC. So once you have a confirmed test, 14 days self-quarantine.
Got it. Well, that's probably not what people wanted to hear, but we got it. So this is from one of our Twitter followers. She says, where do we find instructions on caring for loved ones, those who maybe are waiting on test results or who can't be tested but are presumed positive for COVID-19? This woman says that she may have to care for an elderly family member at home, but she doesn't know how to properly.
To get same advice that you would have for flu, keep the person comfortable, keep them rested. There are anti-inflammatory medications. You see some people say don't use ibuprofen because of recommendations from France, but at this time the US has not issued those guidances. So it's really exactly what you would do for the flu. Whatever makes you comfortable, continue to do that. You know, people talk about chicken soup and all these different home remedies. If that's what makes you comfortable when you're normally sick, do those things, but definitely watch your breathing. If your breathing starts to change and you become short of breath, go to the hospital immediately. That's the one thing about COVID-19. It does seem to turn quite quickly. So be very focused on your loved one's breathing. Listen to their breathing. When they talk to you, are they losing their breath? Those are the kind of things you want to do with this one that are a little bit different than the flu.
Got it. So this is another kind of goes along with that whole question about the period of the
question. We are scrambling as scientists to answer that question for you. Evidence again out of China just showed 21 days in asymptomatic people who didn't show any signs at all, were continuing to put the virus out there for about 21 days. So we're trying to answer that question. But it does look like it could be a little bit longer. That's why you've got the 14-day quarantine recommendation, and we'll see how we use the latest data that we've got from China.
So going along, this is actually one of our reporters' questions. Go with that, and what do you think the U.S. is going to, what kind of rate do you think the U.S. is going to have?
If we look at the average mortality rate, it looks like it's somewhere around 1 to 2%. You definitely see Italy and France much higher, and Germany much, much lower. The reality is a lot of countries are only testing sick people. And if you only test people that are sick and wind up in the hospital, it's going to look like your mortality rate is much higher than it really is. In the US, we fall in that bin. We don't %, but the numbers may not reflect that until we have enough tests to test the people that aren't that sick. So it's challenging right now until we get all those tests going.
Got it. So this is a question from another one of our reporters. Is the state prepared to handle if, like we talked about, the mortality rate is varying a lot. If that rate goes up, especially in Alabama, is the state prepared to handle a large number of deaths that could occur if coronavirus gets worse here in Alabama?
We have limitations as well. There's a great article published today talking about the number of hospital beds we have in this state. If everyone got coronavirus this months, we're in pretty good shape. But again, that's really dependent upon how quickly the disease moves through our population.
And I know there are places that have set up kind of temporary cemeteries, things like that. Is there anything that Alabama has planned in case of a worst case scenario situation?
That's a great question. I haven't heard that yet, but that would be something you would think they're planning for, just in case.
Right. So here's another question from another one of our reporters, if I can speak. Is there any point in getting tested if you think you might have had the virus and already recovered from it?
No, not really. We don't have a good blood test to see if you've recovered. We only have a test where we can stick something way up in your nose, practically to your eyeball, to see if you're actively producing virus. Once you've cleared the virus, we don't have a test that can indicate whether you already had it in the past. Hopefully we'll have one. There are great scientists working on it, but we don't have one today.
Is that that kind of goes along with something that I was wondering personally, the people who have been diagnosed with coronavirus and who have recovered from the disease, from the virus. I know there are plans to do this, but how long do you think that it will take for scientists and doctors to be able to take those antibodies that a person who has recovered from and use those to help fight this virus for other people?
Great question. It probably will take 12 to 18 months for us to have some type of solution like that. That's exactly what they're working on, though, to have those types of antibodies to make it so that people don't have to get sick to actually be able to fight the disease. We just don't have it yet. And we still aren't totally sure whether or not you can get reinfected if you've been infected once. Originally, we thought no, but there's some evidence in other places that reinfection may be possible. So again, it's an evolving virus that we're trying to learn as much about as possible, but we still don't have all the answers yet.
So here's another question about transmission. So there have been different conversations and articles going around that maybe COVID transmission could be reduced in higher temperatures and humidity and be seasonal like the flu. Is there hope that the warmer temperatures could give us some relief from the virus?
There's hope, but that's all there is. Singapore battled an epidemic in the middle of very hot, very humid weather. So that's probably unlikely, but it remains to be seen. We're certainly all hoping that's the case. Absolutely.
But we might not know until it gets warmer and we figure that out.
Right. And it's probably unlikely.
And why would that be unlikely?
Because of what we saw in Singapore. So Singapore was in the middle of those hot, humid temperatures.
Now shifting into some questions about things happening in the hospitals. Are hospitals like UAB planning to cancel elective and non-essential surgery farther out from April?
I haven't heard yet. I haven't gotten that communication from UAB. That's certainly one of the things they'll consider, though.
And as another hospital question, as rural doctors, how do those doctors and medical professionals get PPE and gowns? There's a Twitter follower that lives in a rural area and is a doctor and said he has not had any luck getting those since February.
Yep, he's seeing what a lot of people across the state are seeing, and Alabama Department of Public Health has been doing a great job in the last week of trying to make sure that people that need PPE get it, but there was a shortage leading up to that. So, and people were ordering the PPE and they didn't actually need it because they weren't physicians, they weren't nurses. So hopefully you'll start to see that soon, but you're exactly right. There was a big slowdown in getting PPE to those doctors that need it.
And getting a lot of questions on Facebook from people who are watching right now Kelly asks, are there GI symptoms that are being seen with the coronavirus symptoms? That's something that a lot of different people are talking about in the comments, and that, that seems to be something that we didn't hear of when the kind of symptom list first came out, but it seems like now is being more talked about widely.
Absolutely. There are two big studies that came out this week, one from the US and one from China. And it does appear that GI symptoms, especially in children, the China study showed that GI symptoms were actually a very common symptom. So it does appear that GI symptoms could be an indication of coronavirus infection.
There's also some other questions going around about pregnant women and how they should be handling this, how they should feel about going, doing their doctor's visits to the hospital, things like that. Often
we are concerned about pregnant women, but in this particular case, they don't seem to be more vulnerable to infection and complications from and to check on the health of the baby. So any pregnant woman should check with their OB and say, are you still seeing patients? Can I come in? It's fair for you to ask the OB if you're pregnant, very fair questions to ask an OB. But definitely pregnant women do need to continue to see their doctor if their doctor's asking them to come in.
And this is now it's left me, but I think it was Kathy. I think it was Kathy or Kelly was her name, and she asked a question that went along with another one from Twitter. If you have a person in your house that has coronavirus, somebody you're living with, your spouse, your partner, your housemate, at that point, is there a need for them to kind of self-isolate away from you, or is the virus already in your air, in your home? Are you already exposed at that point? And Kathy asked on Facebook, would it help to open your windows at home if that's the case?
It probably would not help to open your windows, although it might make you feel better, which is important. Keeping your mental health intact is also very important. You should definitely distance if one of your family is sympathetic to all parents, or even people that are taking care of elderly family members that can't get out of bed. Sometimes you can't socially distance. If that's the case, just be sure you're washing your hands. When you leave that person, wash your hands. Find a song you like to sing for 20 seconds and wear a mask when you're caring for them if you could find one. Although the key precaution is those hands. Keep those hands clean. And then change your clothes often and wash your clothes often as you're coming in contact.
Parks are not closed at the moment. There are several that are, but there's no order for them to close. Are going to walking trails, parks, state parks, things like that, is that safe for people to do, or do they need to kind of stick closer to home?
Absolutely. I go on a walk every morning around my neighborhood. I stay 6 feet away from people if I come in contact with them. Try to say hi because it's kind of scary right now and it seems strange to walk by people and not say hi, but maintain that 6 feet of distance until we learn something else about the virus. It does appear, even if that person were to sneeze, that the particles wouldn't make it all the way to me if I'm 6 feet away. So for right now, keep up with your activity unless we learn something different, because it is important to keep moving and stay healthy in this time as well. Those parks are open. I just saw in Mayor Woodfin's announcement that he said, if you're going to go to Oak Mountain State Park and take a hike, go for it. Just maintain your social distance. So you're right. At this point in time, those parks are open. You don't want to congregate there. You don't want to touch the railings and sit and have a group of 10 or 15 people just having a chit chat. You just want to get there, do your activity and go, and maintain good social distances.
And Beverly asked on Facebook, could probiotics help those who are pre-symptomatic?
Probably not. We don't have any evidence that would be helpful at all, but they're good for other reasons. So feel free to keep taking them.
Let's see. We have some other questions about thoughts on how Birmingham has handled this and Jefferson County has closed a lot of things. The state has not exactly followed the same rules. What are your thoughts, and what is the medical community's thoughts about the whole state following suit of Birmingham and issuing shelter in place and closing down most businesses?
Yes. Well, outbreaks are managed at the local level. You contain an outbreak by focusing locally on where the cases are happening. So it really made sense that Jefferson County took much more aggressive actions. And then Mayor Woodfin took even more aggressive actions this week. We have the most cases. Our rate is growing at the highest level. So that made really good sense at the time. The rest of the state of Alabama, you're starting to see cases pour in from other parts of the state. So it's likely that they'll have to take the same measures. And again, it's not something that's easy to do. It's something that has to be enacted politically rather than by the health department. As a health community, we would love to shut everything down, but we really need the governor or county commissioners to decide what's in the best interest of their county.
Crystal asks, what about the air? If somebody's infected and walks by in front of you and you breathe their air, are you going to get infected that way?
Highly unlikely. We really don't believe it's airborne at this time. We believe it's coming from secretions in your lungs, like mucus and snot, whatever you want to call it, coming out of your nose, coming out of your lungs. It does not appear to be airborne at this point in time.
So you have to get cough, sneeze, etc. on at this point. That's
yes.
what the research is showing.
Yep, and then it has to get into your body. So they'd have to cough on you, into your face, into your mouth, or you'd have to catch it in your hand and then touch your face and your mouth.
What about this is actually a good question on Facebook from my wonderful mother-in-law. And she asks, what about the red eyes? I heard about that. Is that true in all coronavirus cases?
It's not. No, that is one that's not true. Not everyone gets red eyes.
That could,
but yeah,
I'm sure
I read that as well.
And I'm sure that could also be from allergies. Unfortunately, we got flu, we got allergies, we got all the things happening right now.
Yep, exactly. This allergy season basically hit the same day that we all shut down.
Wonderful.
Mm-hmm. Yep.
That kind of goes off on another rumor I've heard a lot, saying that maybe some people earlier this year who got the flu maybe have had early forms of coronavirus. What do you think about that?
Absolutely. I cannot wait for us to be able to test those samples. And to your other comment before about having a blood test where we can tell if you were previously infected.
And are those, so I actually had the flu earlier this year. When you get a test for that, does the doctor, you say you're looking forward to looking at those samples. Are those samples kept?
In some cases they are. We don't tend to keep them in Alabama, but other states do keep samples. And the CDC keeps samples. So hopefully we'll be able to look at some of those samples at some point, or at least there will be a blood test where we can draw blood in people that had flu negative, because we do have a database of people who are flu negative. We can call you up and say, hey, would you mind if we test your blood to see if you have these antibodies against COVID-19? So that's a test that would help us to look at it as well.
Interesting. And something that everybody has been asking, and I think everybody's thought, with all of the restaurants mostly doing these curbside pickup, delivery, all these different options, which is wonderful and great. How does that go in with the safety of keeping away from people and their germs?
You should be very safe. All evidence indicates that is not going to be a way that spreads the disease very quickly. If you're really worried about it, if you're someone who's vulnerable, say that you're over the age of 70 or have hypertension or diabetes, you might want to wipe that package down. And then again, wash your hands. After you've opened the package, before you put fork to mouth, wash your hands. Because that's going to be the food itself is highly unlikely to be contaminated. That outer packaging would be just
the downtown county and UAB testing site information, so people can see it while we take a few more questions. First, there's several people, Victor, and then I think it was just Victor actually several times asked, does breathing in steam kill the COVID-19 virus in the early stages?
Now we have no evidence to indicate that it does.
Okay, Victor, so your answer is a no, Victor.
No, yep.
Let's see. I know that, and another similar one from Gina, does heat kill it?
Not that we know of. The answer to that is no as well. Extreme heat, absolutely. Boiling, hot temperatures, but not 85 like it's going to be in Alabama today.
Got it. And I know something they were talking about nationally earlier this week is these new rapid tests that come back within the same day. When do you think that will be available widely, and especially here in Alabama?
Last I saw, 3 weeks. We're still 3 weeks out from getting them, but that is really exciting. That's an opportunity. It's also a little bit less invasive, the rapid test, so we're excited to see those roll out.
That doesn't seem that bad. 3 weeks to wait on those rapid tests. That timeline's not as long as I kind of expected it to be.
No, it's not. Now, if they deliver in the time that they said, that'll be another challenge. But right now, it looks like 3 weeks till they have them ready.
Right. And let's see. Jamie's asking, can you clarify your comments about not being airborne? Is it only contained in respiratory droplets?
That is correct. Yep, it's in respiratory droplets, specifically mucus-related respiratory droplets. So the phlegm, things that you cough up, that's where you find high concentration of the virus.
And Leslie asked, are workplaces being notified if an employee tests positive, or rather, does the business have to notify other employees?
Right now, we don't have mandatory reporting. So there could be cases where a person tests positive and you don't find out. That may change in the future, depending on who you will.
And last question for you, unless you have anything that you've got to say, something that I've heard several people ask about. What about your mail? What about the actual USPS mail? What about your Amazon packages? All those other things come into your door. The online shopping that we're all doing during this quarantine. What about those packages? What do we need to do to make sure that we're not bringing in germs when we bring in that mail or those boxes?
Again, they're not likely to be terribly infected. There have been tests done on those packages, and they don't seem to contain very much virus, if any at all. So it's very safe. But a good hygiene practice right now is to open that mail, open your package, get out whatever you want to get out, and then go wash your hands. Thinking about washing your hands as often as you can possibly do it is really a good idea right now, until we have a better idea of how to control this particular outbreak.
Got it. Well, thank you. I think you're fuzzing up your video on us a little bit. So it's a perfect time for us to cut off anyway. We appreciate you and your time so much for answering our questions. And
thank you.
We hope you'll come back and answer some more.